So I'll be presenting the results of a multi-center study looking into the characteristics of cardiac events following radical radiotherapy for lung cancer. This is a very large study, and we're looking into the results of thousands of patients. So it's one of the largest studies conducted looking into this setting. We're looking into a number of cardiac events, so ischemics or heart attacks, also arrhythmias, so they're problems with the conduction of the heart and the heart rate, heart failures, and also pericardial effusions where you have a rim of fluid surrounds the heart, which can also lead to problems. So I think the biggest thing that people have found in recent years is that in comparison to previous findings where cardiac events happen much longer after thoracic radiotherapy, perhaps decades earlier when people followed up patients who had radiotherapy for breast cancer or lymphoma, where cardiac events happen 10, 20 years down the line. After lung cancer radiotherapy, we've seen a much sooner onset of cardiac events after radiotherapy, so probably in the first year or two. And this is very significant because a lot of them are ischemic events and they negatively impact on patients' survival outcomes. Well, that again is a very good question. So currently there's little understanding of the mechanism of cardiac damage induced by radiation. There has been some laboratory studies, but there is no consensus, I think, on exactly how things happen. A lot of the observations we've made clinically is that obviously this is a very complex area with lots of confounding because a lot of these patients have a heavy smoking history, they have a high prevalence of cardiac disease at baseline, and therefore any association becomes quite challenging. But we have found that significant patients who develop a cardiac event didn't have a cardiac history previously. So that itself is very interesting. So whether the radiotherapy process accelerated aging in the heart, accelerated the atherosclerosis process in the heart. So that's something that is well worth looking into. So again, that's very interesting because there's been a lot of studies looking into this, and there again is no clear consensus on how low the radiotherapy needs to be to the heart before we see a protective effect. We're starting to look into this, and we're trying to get more data, and we're trying to use our computer software to see which areas of the heart are more sensitive to radiation damage. So rather than talking about radiation to the whole of the heart, we're trying to identify vulnerable areas where we can perhaps shield in the future, because you'd want to treat lung cancer adequately as well. So there's always a compromise if you try to lower dose to one particular area. I think this will be an important upcoming area because we're now looking to use more radiotherapy and we're treating a greater number of patients. And it's not just radiotherapy for a more advanced disease, and we're using more stereotactic radiotherapy for early stage lung cancer and oligometastatic disease as well. So I think this topic will be more relevant in the future, and also we're seeing improved survival with the addition of immunotherapy. So I think the more we know about this, the more we can do to further improve the outcomes of patients.